Dear college, dear chairman, it is my pleasure to introduce my PhD project. I am Máté Éliás and I'm a third-year resident fellow. My vision is that in the future, having a child above the age of 40 will be not a question of luck anymore, but a result of a good quality, safe and effective treatment. Therefore, I want to work on novel treatments of infertility. We have two ongoing projects at the moment, both of them in connection with the PRP treatment of the ovaries. Our first project will be a meta-analysis to collect and evaluate the evidence which is existing so far in this field. Nowadays, the age of planned to having the first child is prolonged to a more and more mature maternal age. That's why specialists who are working in the field of assisted reproduction have to face the growing challenge to treat patients with diminished ovarian reserve. Infertility affects around 1 out of 7 couples worldwide. Diminished ovarian reserve is one of the most common causes of death. IVF is the preferred treatment for these patients. As the graph shows, fertility of a woman rapidly decreases over the year of 40. At the age of 45, even with the help of IVF treatment, the chance to have a child from an own oocyte is less than 1%. For these patients of the worst prognosis group, oocyte donation is the only chance. But this is a very controversial option. It is not acceptable for everybody because of some financial, ethical, or religious reasons. Enhance the number and quality of the own oocytes can be a good alternative for donation. PRP treatment is a relatively new, promising method which was successfully tried out in several fields of medicine. In case of both human and animal studies, the levels of FSH and AMH improved after the ovarian administration of PRP. In case of some patients with a very bad prognosis, they were able to reach spontaneous pregnancy after this treatment. Despite these promising results, ovarian PRP treatment is still not widely accepted in the clinical practice. In our meta-analysis, we want to investigate the effectiveness of ovarian PRP treatment of patients with diminished ovarian result. We want to collect the main fertility parameters and outcomes. We conducted a systematic search in these 5 databases with this search key, and our results are very promising. In case of biochemical pregnancy, 17% of the treated women were able to reach biochemical pregnancy, which means that roughly 1 out of 5 treated women became pregnant. It is important to highlight that these patients are from the worst prognosis groups. Most of them had decades of infertility and several unsuccessful IVF treatments in their medical history. For most of them, oocyte donation would be the only existing chance according to the existing protocols. In case of live births, 10% of the treated women were able to deliver a healthy child. This number can be even higher because most of the articles were published before every ongoing pregnancy would be able to succeed in live births. The most surprising result is the relatively high number of spontaneous pregnancies. 77 women, which means 6% of the treated population, were able to reach pregnancy after the PRP treatment without any other further hormonal support. This is a very good result in this bad prognosis patient group. In case of other fertility parameters, we also have very promising results. the number of ultra follicle count was significantly higher after the PRP treatment, and the number of retrieved oocytes and the number of fertilized embryos were also significantly higher after the PRP treatment. Let's see the hormone levels. In case of FSH, in the second and third months after the PRP treatment, the level of FSH was significantly lower than before the treatment. In case of AMH, which is the most important prognostic factor of the ovarian reserve, in every 3 measured months, the level improved significantly of this hormone. In case of estradiol, we were able to observe a slight improvement, but the level of it didn't reach the level of significance. This was also the case in the mid-cycle estradiol levels. The LH changed parallelly with FSH. It also decreased after the treatment, but it didn't reach the level of significance in these 2 measured mounts. We have to mention some concern about our analysis. The first thing is that in this field, the quality of the publications is pretty poor. There is no published RCTs so far. The other issue is that there's a relative big heterogeneity among the published studies in the question of the administration and production of PRP, and also in the IVF protocols which were used after the PRP treatments. We also have to mention that almost half of our patients came from 2 studies of the same author. Our conclusion is that PRP treatment of the ovaries can improve the pregnancy rates and fertility parameters of women with diminished ovarian reserve. According to me, more RCTs are needed in this field with a bigger patient cohort and with an uniformed treatment protocols to gain more reliable evidence. At the moment we finish the manuscript, we plan to send it to the internal review in this week. Our second project will be an RCT in the same field. In this study, we want to find out what is the ideal time between the administration of the ovarian PRP and the IVF followed after them. The PICO will be very similar like in our meta-analysis. Here we listed some eligibility criteria. In our study, the treated group will get a PRP treatment and an IVF after that, and the control group will get only the IVF, and therefore we can compare the results. We want to measure the same outcomes like in the meta-analysis. I think PRP is a very promising new method which can help a lot of which have a lot of questions to answer, but it can help a lot of couples to improve their quality of life. It's also important to highlight that it cannot simply support IVF, but it can promote spontaneous pregnancy. Thus, it can help those patients too who reject the idea of IVF for some reason, for example, for religious reasons. And thank you for your help.
Nice presentation. In which case are used PRP treatments in the science?
Oh, yes. I mentioned that PRP treatment was successfully tried out in other fields of medicine. Mainly, they use it in regenerative medicine, in traumatology, after some trauma of the tendons and bones and muscles, and also in fertility treatment, they regularly use it to improve the thickness of the endometrium, to support the IVF treatment that way. In case of the patients who had implantation failure problems. Thank you.
Is it available in Hungary in daily practice for infertility treatment?
No. So this is the simple answer. With my supervisor, Dr. Sipos, we are working on it to make it available. I hope if we were able to publish this RCT, then those who make the decisions in these kind of questions will support our request.
And another question, a diminished ovarian failure as a definition involves premature ovarian failure as well, or
diminished ovarian reserve.
Sorry.
And it include the patients with premature ovarian failure, and also those one who are simply getting old, and that's why their ovaries are diminished.
Thank you.
Congratulations on your work. I would like to ask, how can I understand that this is, how does it work? This platelet-rich plasma. What is the mechanism behind this? And also the second question, maybe for the first project, what was the age threshold for the patient? Were they also older than 45 years as you plan to involve, or younger? Thank you very much.
I have to ask a question about your question. So you are interested in how does the treatment looks like, how they put the PRP into the ovaries?
How does it work? What's the mechanism?
Okay, it's very complicated. It's more or less physiology. The PRP can improve the level of VEGF and other factors which support angiogenesis. It's also this question is still not answered very well yet. They had some ideas about it, and they think that this is the way how it works. And the other question was the age of the treated patients. It's also very different between the studies. Most of the treated patients are around 40 years. The threshold maybe was 50 or something like this, because some of the studies treated patients not only to have pregnancies, but to treat the menopausal problems. And also in these studies, they noted some spontaneous pregnancies, so that's why we included them.
And how is it administered?
It's administered vaginally. It's the same way how they collected the oocytes during an IVF treatment. So vaginal ultrasound, a needle, and they can collect it they can sometimes just after the collection of the oocytes, they can inject the PRP to the ovaries, and that way, if this cycle would be a failure, then in the next cycle, they can try a new IVF just after the PRP treatment.
How many cycles are administered?
Side effects?
Cycles of treatment, so is it once or more?
It's also very heterogeneous between the studies. There were some studies where they gave 3 or 4 cycles of PRP, and just after they started the IVF, in some studies they gave one cycle of PRP, but after they waited for 2 or 3 menstruational cycle, and after that they started the IVF. And sometimes they just injected the PRP and they start the IVF at the same time. So it's very heterogeneous.
And why is it not available yet? Is it an experimental method, or it has been already approved in some countries, or?
I think in those countries where they use it, it's still an experimental method. But in some countries, the laws are less strict than in Hungary, and they can use it. In some Turkish authors had papers with more than 500 treated patients. So there they do it in their everyday practice, despite the fact that it's still not proved to be efficient officially with a big number patient number study.